What was your childhood like? Did you have guidance and support? Did you feel safe and loved? But what if your life didn't start out that way? What if you didn't feel safe or loved? What if you were always hungry? What if something horrible happened to you? Traumatic events can lead to mental illness. A developing brain needs a healthy environment in order to grow.
It does seem like kids are going through a lot more these days.
I think that it's definitely a different world than it used to be, and the kids are struggling and facing a lot more challenges. It's just not as safe.
Kids today face adult-sized problems, issues that if they don't learn how to process, cope with, and address, will have a detrimental and lasting effect on the rest of their lives.
We work with a lot of children here that are dealing with trauma, whether it's a loss of a parent from a tragedy.
Physical abuse, sexual abuse, it's generational. When you get the families in and you start to talk to the parents
will a lot of times say, it happened to my mom and it happened to her mom. So it's something that's what they've known as normal.
And breaking that pattern and that cycle is what's really important. And I think that's where we come in and can be very helpful.
Through individual, family, and group treatment, children who come to Chesapeake Health Care build fortitude, learn skills and coping mechanisms to help them overcome adversity and rise above their life challenges.
Be safe. Yep, we always want to make sure we're safe. Yep, make healthy choices.
If a child's developmental stages are not met, it affects them as an adult. Different experiences and trauma can affect the physical part of the brain, not just the emotional piece.
They walk in with the heavy burden of what's going on at home, and they don't put it down. They still carry it at school. And so part of what, my work is to try to help them put that burden down and, hey, you still can be successful.
I think to myself when they come in, how am I ever going to be able to help this child or this family? And then within a matter of months, you start seeing behaviors change and things like that. And it's like, wow, the therapy really does work, especially when you have that caregiver or parent involvement.
Chesapeake Health Care also offers quality of life services. Our transportation shuttles pick children up from all over the 3 lower counties and help them get to our after-school therapy programs and activities.
So I can give her the glitter. Let me see.
This time of the year, they're starting to say, are we doing that summer program again this year?
The kids talk about it all year. We come back first day of school and they're like, Miss Carrie, when's summer program? We have kids that live 20 minutes from the beach and had never seen the ocean before.
So it was really exciting to see the joy that they were, coming over the bridge into Ocean City. Oh my gosh, I've never been here.
A lot of times that's their highlight of their week. We get to take them to do things and have group therapy sessions where we can talk about feelings and emotions. And it always amazes me that some kids don't even know what basic emotions are because no one's talked to them about it. And when they have a free space to be able to talk about it, you see the change. You can see them. They're different.
Every kid deserves a chance to have a childhood where they are loved, supported, and taught the things we all need in order to become happy, healthy, contributing members in our community. It's these very same children that will one day, not too far off, become our leaders.
They're our future. They're the people that are going to be taking care of our community in 10 years, 12 years, 15, 20 years.
My dream job is to be in the Army. My dream job is to be a nurse.
My dream job is to be in the Navy.
My dream job is to be a choreographer.
My dream job is to play soccer.
So they're learning, that there is a community out there, and it's opening their eyes that there's other, supports out there and people that care about them too. And our goal is to help them throughout their lifespan.
It's essential for the health and future of our 3 lower counties here in Maryland to make sure that all of the children in our village are given the help and resources they need, not just to survive life's challenges, but to grow through them and thrive.
Children are resilient. That's the good news about, any kind of therapy. Children are so resilient.
Donate today for our tomorrow. Help us build a bright and healthy future for our community. Chesapeake Health Care, your community health center.